Hello everyone, a very warm welcome to all of you. Hope all of you are doing well and keeping safe. Thank you for joining us today for this webinar on our fellowships. My name is Himashri and I am a Senior Executive Science Communications at the DBT Wellcome Trust India Alliance, and I will be your host for today's webinar. Before we begin, let me quickly give you an introduction to DBT Wellcome Trust India Alliance, or India Alliance for short. So we are an independent, dynamic public charity that funds research in health and biomedical sciences in India. India Alliance invests in transformative ideas and supportive research ecosystems to advance discovery and innovation to improve health and well-being. We are being funded by the Department of Biotechnology, Government of India, and the Wellcome Trust from UK. Today we are here to talk about the recently launched fellowships under the Clinical and Public Health Research category. You will learn more about these fellowships in today's webinar, so stay tuned. Before we begin, I would like to share a few housekeeping pointers. So this webinar is being recorded and highlights of the webinar will be shared on our YouTube channels at a later date. Video and microphone of all of you attendees will remain switched off during the event. You can leave any question that any time during the webinar in the question box to your right in the screen. You can please make sure that the question only relates to the topics that are being covered in the webinar. You will also see a chat box, so you can put any comments you have related to sound issues or any other technical issues in the comment box. During the question and answer session towards the end, we also have the option of allowing you to raise your virtual hand to ask a question. Once you raise your virtual hand, we will select your names one by one and unmute you. In case the webinar ends abruptly due to technical glitch, please join back using the same registration link that you had used now. And now on your screens, you will see the agenda for today's event. So the webinar will have the following sessions. We have the opening remarks that are being done. Then we have overview of CPH, which will be given by the India Alliance grants team. We'll have an experience sharing about the India Alliance experience in context of CPH fellowships, which will be given by a CPH fellow. Then we have the expectations of the selection committee by our esteemed committee member, Professor Tendolkar. And then after a quick question and answer round with Professor Indra, we will have another experience sharing by Dr. Susmita Chatterjee, another CPH fellow, and then we'll open it up for the question and answer session. So the first session that we have will be an overview of the fellowship schemes. My colleagues, Ms. Isha Goel and Dr. Devyani Samantarai will take this session. So let me introduce both of them to you. Isha is a grants advisor at India Alliance. She is a nanobiotechnology engineer possessing MTech in nanobiotechnology from the IIT Roorkee and has done her BTech in biotechnology from MIT Noida. She has ardent research experience, especially in biomedical domain, which she has translated into a patent for burn wound healing patch. She has also worked in several biotechnology firms in Delhi, where she was part of the management team for National Plant Tissue Culture Certification System and setup of new ventures. While Dr. Devyani is also a grant advisor at India Alliance, and she has done her PhD from the National Institute of Technology in Roorkela, Orissa, and her postdoctorate from ILS Bhubaneswar and University of Hyderabad. She is coordinating the CPH fellowships webinar today. So I'll hand it over to both of them for taking it forward. Thank you. Over to you.
Thank you, Himashri. Thank you for the introduction. So I am Devyani, and so I'm managing the CPH competitions this round as a secretary of the competitions. So before we proceed to the session. I'll just briefly let you know that we have with us our Professor Inda Tendulkar, who is the Deputy Chair of the CPS Selection Committee, and she'll be with us for a short time. So we will have her session and then a quick question and answer session just immediately after that, so that we can answer your questions pertaining to her, for her. So we'll begin with the presentation by Isha, where she'll go, well, she'll briefly explain about the schemes, our policies, and what's our mandate, our application process. So right now I'll hand over to Isha. Isha.
Sure. Thank you, Devyani. I'll share my screen and is my screen visible?
Yes,
Okay.
it's visible.
So, a very good evening to everyone present here today, and welcome to the webinar on Clinical and Public Health Research Fellowship. As many of you are aware, the call for application is presently open and preliminary applications are being accepted for the ongoing CPH round. So today we will be talking about the mandate of the CPH Fellowship Scheme, the provisions, key policies, and the components of the preliminary application. So India Alliance Fellowship programs are for a duration of 5 years. Fellowship applications are accepted to the basic biomedical research, clinical and public health research areas. Under the following three categories: the early career fellowships, the intermediate fellowships, and the senior fellowships. Today we will be mainly focusing on the clinical research and the public health research areas, which comes under the clinical and public health fellowships from India Alliance. The eligibility for the clinical and public health CPH competition is from the final year to 15 years post the qualifying degree, which is MD, MS, MPH, or equivalent clinical and public health research experience. In order to apply to this scheme, clinicians and public health researchers do not require a PhD, and there is no age or nationality restriction. But candidate needs to be willing to establish an independent research career in India. Early career fellowship is for applicants who are starting their independent research career. This is a mentored fellowship. The fellowship supervisor is added on the application who helps acquire skills, training, provide resources, and supervise completion of the project. While intermediate fellowship is suitable for applicants who are newly established or are in the process of establishing themselves as independent research investigators. Senior fellowships are for those applicants who have established themselves as independent investigators and who would now like to lead a large program of research. So applicants are advised to choose the most appropriate scheme from early career, intermediate, and senior as suitable for them based on their qualification, research experience, career trajectory, and track record. Coming to the remit of India Alliance is to support biomedical research that is relevant to human and animal welfare. This includes the full spectrum of biomedical science involving clinical and public health research. Please note that the clinical and public health competition is open only to the applications that have proposals with clear clinical or public health relevance. If you are not sure about the remit of your proposal, please feel free to write to us at info@indiaalliance.org with your CV as well as a 200-word summary of your proposed research, and we'll get back to you. Next, we will be going through the life cycle of an India Alliance Fellowship. The typical life cycle of an India Alliance Fellowship competition, as it starts with the preliminary application, and ends with the fellowship award. So the preliminary application includes the CV, 750-word abstract, and at least one letter of recommendation. Based on this prelim application, full application are invited, but by invitation basis only. The full application is more comprehensive with is a more comprehensive form with multiple sections and with the larger proposal support letters, and it has a lot more. It requires a lot more details. Then the full applications are sent for international peer review, following which the applications are shortlisted for interviews by the committee. After the interviews, applicants are chosen for award or decline based on their performance. The whole process takes about 10 months. Applicants should kindly bear in mind that the whole application cycle takes 10 months. Coming on to some key policies and conditions of India Alliance fellowships. First is the most important resubmission policy. According to this, once you submit a full application, you cannot compete again in the same or a junior scheme. So if you have submitted a full application or you cannot compete again in the same or junior scheme. So if you have submitted a full application for intermediate fellowship, you cannot apply again for early career or intermediate regardless of the decision. And you can, however, apply for the senior schemes. Second is the dual fellowship policy. Dual fellowship policy is that is one may apply even if you hold another fellowship. However, please note that if awarded, the applicant will be required to make a choice between the current fellowship that they have and the India Alliance fellowship that is being awarded to them. So they can only hold one fellowship at a time. Third is about salaried appointments. Applicant may or may not have a salaried appointment at the host institute while applying, but in case of an award, the applicant cannot have a salaried appointment other than the one at the host institute. Fourth is the India Alliance policy on plagiarism. India Alliance actively checks applications for plagiarism, including self-plagiarism. Applicants are advised to avoid copying sentences and paragraphs from different published sources, including your own publications, and carefully check for plagiarism before submission. Last is the time commitment policy. You are expected to spend majority of your time on research with any non-research activities such as teaching, administration, or other institutional responsibilities not exceeding more than 2 hours per week for early career fellowships and more than 8 hours per week for intermediate and senior fellowships. In this slide, we'll be quickly going through the key provisions that are provided in CPH fellowships. So as we have discussed, these fellowships are for 5 years and one cannot ask for a lesser duration. And the interested clinicians and public health researchers have the opportunity to pursue their research goals alongside their clinical duties. India Alliance recognizes that clinicians and public health researchers have to put in substantial efforts to pursue their interest in research along with other clinical responsibilities. Hence, India Alliance offers generous personal support for their efforts, and also there is a generous research support. So the eligibility criteria is the same for early, intermediate, and senior. The budget cap for early is 1.9 crores, while intermediate 3.8 crores and senior 4.7 crores. Fellows are provided with salary support set by the India Alliance for each scheme. In case a fellow receives a salary from their host institution, a top-up is provided so as to meet the salary level set for each category. The fellowship can also be used to purchase equipment, though fund requests for expensive equipment are typically not allowed for early career fellowships. It is expected that applicants will choose appropriate laboratories or environments where majority of necessary equipment and facilities are already available. For intermediate and senior fellows, there is no such restriction. There is a flexibility to accommodate requests for support staff in clinical and public health fellowships. ECF, early career fellows, can request for only one technical staff, whereas intermediate can take up to 2 and senior fellow can take up to 4 support staff, including PhD students and postdocs. The request for additional research staff may be considered if proposed work involves field work or if the clinical studies require assistance from additional support staff, given a proper justification is provided. Work outside host institution, or WOHI, is a provision provided by India Alliance. Fellows can carry out a part of their work at different lab outside their host institution. This can be in India or abroad. For working abroad, fellows will be provided with an allowance of $3,000 per month based on the prevailing conversion rate. Early career fellows can visit a lab outside their host institution for 2 years, while intermediate fellows can avail for maximum 1 year. The WOHI option is not available for seniors, but they can ask funds for travel to a collaborator's lab as per need. In addition to for travel to conference, meeting or visit collaborators lab for short visit, we provide up to 7.5 lakhs for 5 years for early and intermediate, and up to 10 lakhs for 5 years is provided for seniors fellows. Finally, contingency funds are provided as India Alliance recognizes that unanticipated costs might arise during the tenure of the fellowship. Therefore, in addition to the requested costs, India Alliance will provide contingency funds to cover such costs. Coming on to roles on the applications. The mandatory roles on the application which needs to be present at the prelim stage are the lead applicant and one additional letter of recommendation which needs to be provided by a supervisor for all 3 schemes. And for early career fellowship, the fellowship supervisor is also a mandatory role on the application. The role of a sponsor is optional at this preliminary application stage. However, one should have identified a sponsor and they should mention about the sponsor, but a letter from the sponsor is not mandatory at this stage. Mentor is optional at the preliminary stage, but is mandatory at full application stage for early career and intermediate fellowships. For further information about roles on application, kindly visit our website. Coming to the application process. India Alliance uses ISS, India Alliance Online Grants Management System, for our application process. Please also refer to our user guidelines for completion and submission of your application. Please ensure that the application is submitted by the published deadline, and note that every role on the application needs to create or log in into their ISIS account to participate in the final submission of the application. So keep time for the same. This is a screenshot of the login page of the ISIS system. Once you log in on the home page, you see the home page, and on the left menu, you will see the section Manage My Details. In this section, please fill the basic information, update the details of your CV, and update the email. This is important, and the information provided here will be mapped to your application. Following this, then create a application under your most suited category, early, intermediate, or senior, and start the new application. This is the screenshot of the new application for early CPH early career. The And there is a navigation panel listing the sections of the application on the left-hand side of the screen, which each will be covering, and each of these sections will be covering in the next few slides. The most essential aspect of the application is the project summary at this stage. The research proposal needs to be submitted that seeks to answer an original research question related to the clinical and public health research. There needs to be a project title. Please kindly make sure not to use any acronyms in your project title, and wherever there is a use of acronyms, kindly expand it. In the prelim stage, the word limit for the research summary is 750 words. And to sufficiently substantiate your research summary, you also have a provision to include the necessary references. Kindly use this to provide a detailed description of the research project, highlighting the clinical and public health aspects. Kindly check the flow of the summary that you are providing and make sure that there is no plagiarism. The next section is about the host institute. It is mandatory that the host institute should be a not-for-profit institute in India that will administer the fellowship for the full duration of the award. As I already mentioned, a salary position or commitment to a salary position at the host institute is not required. And apart from the name of the institute, you need to enter the department where you are going to perform your proposed research and the city. You need to justify why you have chosen this institution and what is the support that you expect to receive from this institution. Mandatory in the early career fellowships, details of the fellowship supervisor need to be provided. So this is only in the early career fellowship application, and you have to use the search option that is provided here in this section to search the fellowship supervisor and add them. The option will and if you don't find them already existing in our directory, you can add them. And once the fellowship supervisor is added, they will receive an email to upload the letter. As discussed, sponsor details are optional at this stage, and you need to fill the relevant details if you have identified a sponsor, and you need to enter the name, designation, organization, department, and city. And if you are yet to identify a sponsor, kindly mention the reason for not having identified a sponsor till date. In the applicant details section, one needs to fill in complete contact information, details of the highest qualifying degree, details about the present status of the host institute, and the time management. In the applicant CV section, wherein applicants need to provide all the details about his education, previous post held, career breaks. Career breaks are duly considered by India Alliance while calculating the eligibility. So if you have a research career break, they need to be detailed enough. Names of past supervisors need to be added in the required sections. A text box is provided to you to add the publications. Please make sure to follow the instructions that are provided there above the text box while adding the publications, as this adds to the grantsmanship of the whole application. Answer the questions about your scientific career till date in detail and also the reason for applying for this particular fellowship. Details of other ongoing grants and applications are to be provided, and a 200-word abstract with specific aims of your current ongoing fellowship or grants can be added to the application. If you are a medical, in the research training section, you are to give us details about if you are a medical or a dental graduate. So if you have a clinical appointment, there are questions regarding the same. And if you are not, then you'll just have to answer about when you started acquiring skills to pursue an active career in research and how would these skills help you in conducting the proposed work. Detailed answers to these questions help the committee. Mentors are optional at the preliminary application. However, if you have identified a mentor, the same can be added. A letter of recommendation is a mandatory requirement. The name, the details of the supervisor can be added. Please note, for early career fellowships, the fellowship supervisor cannot be selected to provide a letter of recommendation also. The fellowship deadline for the preliminary clinical and public health fellowship is 10th April, Monday, 2 p.m. IST. Please note that the deadline is 2 p.m. IST. Thank you. With this, I've come to an end with my presentation. If you have any queries, please write to us.
Thank you, Isha. So hopefully you all have now a clear idea of the application process, and I would urge you to, kindly complete and submit your applications much before the deadline, and not wait till the deadline. And because that might be server issues or any technical glitches might come up, so you can submit as soon as you complete your application process. So next on our panel we have Dr. Srinivas Marmula, our just a minute. Yes, Himashri, can you share the screen? So
Just
Dr.
give me a moment,
Srinivas,
I'm sharing.
yeah. So he is our ex-CPHE fellow, CPH Early Career Fellow, and currently he is an active intermediate fellow. And just a minute. So he is a senior scientist and associate director of the Public Health Research and Training at LV Prasad Eye Institute, Hyderabad. He has completed his PhD from the School of Optometry and Vision Science from University of New South Wales in Sydney. He has completed his postdoc research fellowship with Dr. David Friedman at Wilmer Eye Institute, Johns Hopkins School of Medicine, USA. So as I mentioned, he's the recipient of the Deputy Wellcome Trust Early Career Fellowship in 2015 for his research project titled the Hyderabad Ocular Morbidity in Early Elderly Study called HOMES. And in 2022, he was also awarded the Inter Alliance Intermediate Fellowship for his project on longitudinal eye health, aging and disability study, in short called the LEADS. So he has over 100 publications and several book chapters to his credit. So now over to Dr. Srinivas, who will, he'll give us an overview of his IA experience to us.
Thanks, Devyani. I'll start sharing my screen.
Yeah, please.
Okay, good afternoon, everyone. I want to share my experience with the clinical and public health fellowship that I had. In the next 10 minutes or so, I'll be covering about the key features of the fellowship, some pointers and selection process, my experience as an early career fellow, and then my experience of working with India Alliance reviewers and staff. Thus, I believe Early Career Fellowship is a mentored fellowship program for early career researchers who want to attain independence in public health research. So, Clinical and Public Health Fellowship includes a research project under supervision, career development through skill enhancement, and publications. From my point of view, the unique features of India Alliance Fellowship include transferable funds, flexible funding allowance, overseas training, open access expenses to cover publications which will have a wider reach, and also support to extend the international conferences, generous personal support for clinical and public health researchers, and workshops not only on research but also on leadership and science communication. I believe all these features are extremely vital, and I believe these are extremely valuable features of the fellowship, especially the transferable funds and also the flexibility that you have to interchange between different heads as the research moves on is something which I felt was very useful during my fellowship period. And also a generous support for overseas training again is again I feel is a very important feature of a CPH program. I believe all these unique features focus on generating high quality research, impactful research, and career building for the young researchers who are aspiring to become global researchers in years to come. Whenever we are applying for a project proposal, I believe we need to have a coherent research plan. And this plan should match with individual interest and also in line with the career goals, because this is something that India Alliance is looking for. The project can be designed as an offshoot of the work that is being pursued by the fellowship supervisor in case of early career fellowships, or it could be a completely new project that will take research to new directions, help develop critical thinking among the fellows, and also that will enable to learn new technologies and research methods. I think for the fellowship, I think the research project is very important, and for the people who are applying for India Alliance Fellowship, I want to give some useful pointers. The research topic that one is selecting should be of public health importance in terms of magnitude and impact. The proposal or the approach should be sound in terms of methodology. It should be practical in Indian context, and more importantly, it should be translational. That is, whatever evidence we are generating from the research, we should be able to apply in practice as far as the public health research are concerned. I feel these four elements are extremely important whenever we're presenting a research project for the India Alliance Fellowship. Again, the career track record also determines our fate in the selection process. If at all you are selecting a project that where we have past experience, similar work, that is an added advantage. Our record of achievements also will help us to clear the first round. And also, most importantly, having clear goals and aspirations will be useful. So selection process has been shared in detail. We have preliminary applications, then the full applications, international peer review, and interviews. I think the interviews are, once you cross the first three, the interviews are critical. So the performance interview will decide our fate as whether we'll get the fellowship or not. Typically, the 5-slide presentation in 5 minutes and followed by 25 minutes of Viva is something that has been a classic feature of India Alliance fellowships. And I can tell you, I have applied for when I applied for this fellowship, it was really tough. Everything that you want to do in 5 years, you want to explain in 5 slides in 5 minutes, and then you have a panel of experts who are sitting in front of you asking questions, and facing them for 25 minutes is something that really tests your persistence and also your in-depth knowledge on the proposal. But also, that said, interview also gives us a final chance to defend the research proposal. It can also help us to clarify any pertinent issues that are there in the proposal. And gone through this interview process twice with success, I can tell you that the interviews, even though has a panel of experts, is always conducted in a very friendly environment. And I realize that whenever the panel members are asking questions, the intention is to get the responses and to get clarity on the proposal and never intimidating. I think that is one thing I see is very, very useful, useful comment that I want to make on the interviewers in the process. Again, the people who come to interview process, and again with experience, I can say that whenever a question is being asked, openly acknowledging that I have a deficiency and I am intending to learn this specific element of the project is something that will help us clear the interview very easily. And openly acknowledging our deficiency is extremely important, because after all, it is a fellowship program and fellows are not expected to know everything, especially if you are an India early career fellow. Next couple of minutes I want to spend on my experience as an early career fellow. I took a study called as morbidity in elderly study called as HOMES. This is the study that was done in Homes for the Aged Centers in Hyderabad during 2017 and 2020. This was carried out in 41 homes for the aged centers as a part of this project. We have included 41 homes, closer to 100 people were examined with a mean age of 75 years. And this project has provided vital information on health status of elderly in residential care. About 81% of them had visual impairment, a quarter of them had depression and cognitive impairment, and significant multimorbidity and multidisability. And the research output from this project has been substantial. From the homes, we were able to get 14 peer-reviewed publications. Again, this is a big number considering my early career fellowship, 2 manuscripts under review, and about 5 poster presentations. More importantly, the project and the outcome of the project also received a wide media attention in the national media, and it helped us to plan the eye health initiatives for the elderly. This is what I was talking about, the translation of research into practical application. More importantly, this has helped me to take the next step in the India Alliance career. I applied for longitudinal eye health, aging and disability study, and I got selected for the intermediate fellowship. And over the last 7-8 years, I've been working very closely with the India Alliance reviewers and India Alliance staff. So grant advisors are our primary point of contact. And I feel over the years, I had several grant advisors helping me with the project. And invariably, one thing I felt, the common across all grant advisors are they're very approachable, provide guidance, and whenever we need additional information related to project and policies, these are the people who can give a lot of clarity on. And I also really appreciate the clear and prompt communication I get from these people. And we also had occasions where the India Alliance team members, grant advisors visiting my institute, which is very close to India Alliance office. I also visited India Alliance office a couple of times on different occasions. The accounts team, again, very important for whenever we talk about funding. Again, we have a very supportive and very experienced accounts team. They're very supportive, but as expected, they're very strict as per the policy. One thing that DBT India Alliance has stood the test of time is a prompt and timely release of funds. I never had to write to India Alliance in last so many years asking where are my funds, which is a very rare thing. You know, typically for other granting agencies, we tend to write asking for funds, when are these coming, and you keep on sending reminders. For India Alliance, I never had to do that. It was always prompt. The communication always been clear. And also one thing which I noticed is that whenever your grant spent report is supposed to submit it, there's always a workshop or a seminar that will help you in filling up the forms. Again, a very good help for the early career fellows. I also had some interaction with the India Alliance staff, the communications team, and all those interactions were very good. Again, India Alliance committee, vast and varied experience, a think tank. They thoroughly review the project at timely intervals, give critical inputs, and helpful panel with a positive intent, constructive comments. And they also have a big goal that whatever research is coming out from India Alliance is robust, it's scientifically sound, and also the fellow also takes the career path that is desired by him. In my conclusion, India Alliance fellowships, if I want to summarize, are something that give you freedom and flexibility to carry out relevant research and expert guidance, which form the stepping stones for flourishing and meaningful research career. And this research, especially if you're in public health, impact many hundreds of people. And more than publications, the presentations and H-index, a feeling of gratitude when you really couple research with services. And that is a great feeling you have when you really support these people. And India Alliance has been doing that experience over last 6 years. I'm very grateful for India Alliance for supporting my research over the years, the institute where I work from, L.V. Prasad Eye Institute, my mentors, wonderful team that helps me on my projects, and the participants who gave their time for my research. Thank you all for your attention.
Thank you so much, Dr. Srinivas. Thank you so much for sharing your experience. It was really insightful, and we are glad that our fellowship fellowship and your work has helped you get media attention and even go to the next step. You got the intermediate career fellowship. So next, I would request if people have questions for Dr. Srinivas, you can add your questions right now, because he will also have to leave by 5:30. So after the next talk by Professor Indra, we can take questions for both Professor Indra and Dr. Srinivas together. So next we have Professor Indra, who is the faculty of who is a professor and faculty of medical sciences at Radboud University, Netherlands. So she is also our deputy chair of the CPH selection committee, and she has completed her so she has completed her PhD from the University of Aachen in Germany, and she is an expert in the field of diagnostics and treatment methods in psychiatry, and works at the interface between research and treatment, and applies new research insights to diagnostics and patient treatment with a focus on stress-related mental disorders. She has developed novel experimental designs testing neutral and emotional forms of declarative memory using a wide array of electrophysiological and neuroimaging methods. And she's continuing her research in unraveling the neural underpinnings of chronic and drug-resistant depressions to help optimizing cognitive behavioral therapies of depression. So over to you, Professor Indra.
Thank you so much, Devyani. And I think Dr. Srinivas has very nicely pointed out what is important. I'm very glad, though it is just for short, to get the opportunity on behalf of the CPH Fellow Committee to talk you through some ideas we have from the committee side. Of course, you will. It's a sort of a reiteration of what Dr. Srinivas sometimes has said. Of course, he's a successful fellow, so it's not surprising. And it would be great, Devyani, if you could share my slides. Then I'll talk you a little bit through it, because I think I imagine there's quite some work coming onto you, like how on earth can you do the competitive grant, and you've heard a few. So I've restricted my slides to just a few, because I believe the India Alliance grant team has talked you through the insights, and maybe we can just get started. If you take the first slide, please, Devyani. So I was thinking, like, okay, the next one, please. I think the three aspects I would like to go through with you, and that the first one is like, how can you get started? The second is like, what do you need to take into account? And the last one, of course, is also the reviewing aspect. Both I have not explicitly talked too much about the external reviews, but happy to answer questions about that, but also taking a little bit into account how important the interview is if you have passed those stages. And I think this is also what Dr. Srinivas already talked about, but just to make it true also from our side. So next slide, please. So I think the first thing to start with, we now have beginning of March, and what I have to tell you is that it really takes time to take a good application. I also know for myself that we sometimes tend to have this last minute ideas, or within the team or the faculty, people feel we should start writing something, but particularly for the early career and also the more extended versions, you really need to think through like what you need. think it's good to have the India Alliance timelines in the view. And sometimes you can, of course, also really take some time to find the best place, like where are you going to do it, who's going to be your mentor, and in particular take time to see like what kind of collaborators you want. Do not only rely on the idea of your mentor, but really look around, both India-wise but also internationally, because one crucial aspect, of course, of the India Alliance fellowships is also that you're supposed to carry out some work abroad in order to create synergies and to boost the research which you're doing back home. So I think this is very, very important. And I think really get onto this iteration process on improving your ideas. Try to get feedback within and outside your discipline. If you have to if you succeed in interesting others in the kind of research you're doing outside your discipline, and then I think it's very important, and the impact you create is a lot. And I think you of course also have to take into account what your institutional research office asks in terms of approval. Next slide, please, Devyani. Of course, it all starts also with like why now, why you're doing it. Often it's like getting the next step, or it would be a good point. Sometimes we see that people even start for the early career fellowship while they're still doing a PhD. Is that then still the right point, or you're a bit further ahead, or you had focused on clinical work in between and now you want to get back to the more clinician scientist part? And also really critically think about what is the team surrounding. Is this really the right people? And I think it is important to think about what kind of science you want. The public health aspect was mentioned. I think it is look at the literature, try to be rather simple. We often see way too ambitious things. We often see that people want to learn really new techniques, which is good, but restrict yourself, and really think like, okay, what is the impact you want to create, and how do you want to create it? So in terms of like, what do you want to bring out at the end of the fellowship? Next slide, please. So oh, excuse me, you were a little bit too fast. Yes, thank you. So I think one critical aspect is really, I didn't believe that myself for many years, is if you have an idea and you just write it on the scratchboard, try to summarize your idea and see if it makes sense. In the summary, if you manage to summarize it well, then the rest you can start writing. But the most important aspect is really having a good summary. I often notice that people write summaries at the end because continuously they're changing things. Of course, you may be able to change the summary, but really the summary is very important. And this is also why in the first stage, it is also very important to have to show that you have a certain overview, like what you're doing and how you're doing it and why you're doing it and what is novel, and are the hypotheses you pose are testable, and can you provide the methodological background for it, like how many participants do you have, is this enough power to do it, how can you collect the data, how can you analyze the data, these kinds of things. So next slide. And indeed, this is of course the process, and the grant officers have already taken you through the process, but I think you can always change little details, but the bigger story needs to be there for the preliminary application. And have a sort of a general idea like how you're going to do this. And if you're then allowed to go ahead for the full application, then you really need to write it out in a way that external peer reviewers can understand it. they do not know the particular situation in your lab. They will not know the mentors, so you will really have to explain what is feasible, and then the committee will actually look into whether this makes sense. The grant office is doing a great job getting enough external peer reviews, so we can really come up making a good selection on the basis of whether the external reviewers see merit in it, but also the committee, which also comes with different expertise, has to look into, does this make sense to come on the shortlisting? And if you're then invited for the interview, you've really gone a long way. And in any case, I think it's very a good education experience. And what is important is that reviewers very often give good comments, and on the basis of those reviews, the interview will also take place. So you need to take into account the aspects that are actually named by the reviewers, and often that can be very fruitful. Next slide, please. So please think who is going to help you with the application. Read successful grant application as an example. Try continuously to get feedback. Also get your friends or your family to read your proposal, you know, and comment, experts to comment on it well before it goes in. Don't expect somebody to react with it within 2 days, and really make a timeline where you have enough time, because this last minute thing I also noticed from if I look into like here in the Netherlands, so the European grants are also very competitive. We have a chance of 5% of getting them. So there's a huge timeline, internal timeline, for example, for us to show the grant and get comments to make sure that you are really, you know, at least belonging to the last round. Okay, then next slide, please. I think it is very clear that all sorts of research needs other disciplines, and it's also, I mean, this is also the nice thing about it, like what kind of collaborators would you need? How could you, how could you work together? I think it's also nice to talk to the India Alliance people. Dr. Srinivas mentioned that, like, how can you set up a network? And I think it's also important to contact your financial people early enough to let them think aloud, like how things are going. Such a proposal has to be financially sound, otherwise it's also giving a problem. Next slide. So if we, as a committee, and also of course the external reviewers, they look at the candidate, like what is the career trajectory. That is of course a different way for the intermediate and even for the senior fellowships, and for the early career fellowships, it's like, of what have you been doing? Are you staying in the field? How much have you been, changing gears maybe already, or wanting to become more independent? And I think the important question is also, like, is the proposed project, is it really doable? Are pitfalls taken into account well, and how to overcome them? And of course we also look into the suitability of the setting. So we have seen very good candidates, but the setting was very difficult, and the candidate maybe didn't or want to, or couldn't move the setting. And then of course, as a committee, we also have to express our concerns whether the research can be really conducted, right? So I guess these are things we really advise you to plan beforehand and take this into account. Next slide, please. So as I said, often we see there's a mismatch between the ambitions you have and the experience. If you've never done single cell recording, you should take into account, like, can you really do this in one grant, and what would you need for it? So that is, I think, overly ambitious is something that can be a problem also and the committee really has concerns then approving the grant. It must be very clear that the design proposed should answer the question. There are, of course, many standard methodological aspects, such as, like, what are the control conditions? What is the outcome? Is there a masking? Do you have, like, active control conditions? What are the participants? And can it be generalizable to the wider world, so to speak? Next slide, please. And another one is, of course, the justification of the budget. And what is also important is, how can you work on the capacity building? How can you disseminate your findings? How does it come into, you know, local guidelines whatsoever? And what is the link with other agencies? And this, of course, you should be also helped with by your institutes, or maybe a network meetings also of India Alliance, to have a good contact with stakeholders from other agencies. And I think it is important, once again, to really take the opportunity to discuss matters with India Alliance staff. Next slide. So a few more problems we sometimes see in proposals: too much extra measures, too much secondary outcomes, which are of limited relevance to the main question. If you want to do it, okay, this will develop, but the primary question should be very clear, and how you want to do that, and the statistical power should be based on that. It's very important to think, if you, for a clinical trial, how your control participants will be recruited, and how feasible that will be, what kind of comparison groups you may want to have otherwise, if you have more than 2 arms, and so on. If you have enough equipment of support staff that can help you running out the trial. So once more, is the institutional environment very enough for that? And I think, of course, it sometimes very often maybe the case that supervisors have less time to reading the application critically. Make sure, or try to be to urge them to do so, or get your expertise otherwise. Next slide. So a few more common problems, and I think what is also very important is we really always read thoroughly through the letters of support. If it is just a standard letter, it doesn't tell us much about what a relationship is. If you have a large institute, then of course you may need to think how you can phrase it with the help of your supervisor, you know, so that it will be signed, for example, by the head of department. But it should really be specific to you, for us to get an idea that the institution is also caring about you. Next slide. So this was just a very brief overview. Some of things I said, I kind of replicate of what has been said before, but I guess the issue is really that really take your time to getting started early. Please take into account common problems that have been mentioned, and also try to take into account that the reviewer really wants to understand your proposals, but they cannot judge everything, so you have to make it as clear as possible. And I think this brings me to the end of my presentation, and then I think Dr. Srinivas and myself are happy to take any questions. And of course, it's very sad if you don't get a grant, but every failure also helps you to come a little bit further, as we have just heard before. Thank you so much.
Thank you, Dr. Professor Indra, for that exhaustive explanation of what a committee member looks in a proposal. And we had few questions along with the registration for the webinar, but I see most of them have you have already answered them through your presentation. And I would still yeah, there is one question like, is there any rubric to follow while preparing the application, like any criteria to be followed while assessing the applications, and which are the thrust areas? Maybe the thrust areas, if you think there are any particular thrust areas which the committee looks forward to.
So I'm not sure if I get it correctly. Can you maybe explain it once more?
Yeah, so there's the question that okay, I'll just leave the first part out, because the first part about how to prepare the application has already been answered. So what are the thrust areas? What are the thrust areas is the question. So maybe whoever is the applicant means that wants to know which are the areas where the committee looks forward to an application or a proposal in those thrust areas.
So in general, I mean, as you can also see from the setup of our committee members, there are in the public health domain, there are several things that can be conducted. So whether that is non-communicable diseases, whether that is mental health area, whether that is technical innovation. I think it's not like we need this now. It just has to become clear that it can be a game changer on one way or the other. And really like so that it is really an innovation that after the research is done also makes the chance of getting an implementation. So the biggest problem is you can do nice research, but if you don't get it implemented afterwards, and of course we know that we early career fellowships find it more difficult to do so, and intermediate should know way better how to do it, and senior even more. I think this is the biggest thing. It is not like at this point, at least I would not be able to say this is a hot topic currently. Also, I would be beware, also given my limited expertise in all the different things. This is why we have the committee members, and of course we have the global themes that are ongoing. And if you look at the granting of our last round, I think you get a nice overview of what we found important and what is important. So I'm not sure if this is answering the question.
Yes, I think so. Yeah, it's covering what they mean, because the questions are a bit just mentioned in few words. I suppose that's
I'm not
what
sure,
they
maybe
meant.
Dr. Srinivas has a better idea to it.
Yeah, I think to add Dr. Tendulkar's point, I think the problem what we are proposing is it should be a public health challenge with significant burden, and the solution that you are going to offer is something that is practically applicable given the resources and the research environment that you have. And other thing is that it should be translational, because you're doing a research, as the last point Dr. Tendulkar was mentioning. If you do research and get publications, nothing comes out of it is not a worthwhile thing. So it should be translational. Whatever outcome of the results should be a stepping stone for either implementation, or should be a game changer in terms of creating impact. And from a fellowship point of view, you should acquire new skills so that you can develop into a research career, from early career, possibly intermediate career, where you get more advanced, then probably go on as an independent researcher, contributing to science and society as a whole, I believe.
Thank you, Dr. Srinivas. Just have a few questions. So one question is, how is the fellowship useful for young researchers? So maybe Dr. Srinivas, you can answer it. How do you think your fellowship has helped you as a young researcher?
First thing is that India Alliance, when you apply for India Alliance Career Fellowship, first thing is that it's a fellowship. That means you're not expected to know everything. But one thing that you need to have a clarity on what project that you want to do. And you should also have a very clear career path. This is the path I'm going to take it up. It could be mental health, it could be eye health. Eye health is something that I have taken it. And then once you have that clarity in mind, then you can always apply and move forward.
Okay, thank you. And since for the CPH we have a common eligibility, like from the final year of their MPH or the PhD till 15 years. So there's one question that someone has a post PhD experience of 13 years, and which scheme would be suitable for that person? So so which scheme would be suitable for that person? So for the basic, of course, for the basic category, we do have mentioned that for early careers, we look for, -1 to 4 years. Then for intermediate, we say for 4 to 15 years, but still, it's around 4 to 7 years for the intermediate and rest for the senior category. So for CPH, since it's not like that, it's like anyone can apply for any of the fellowship. Do you have any suggestions about, which scheme do you suggest them to apply to?
So if somebody has an experience of 13 years and can also show that he or she made significant progress in that time, of course, the early career is not what you would want. It's more in the level of intermediate, because for the senior career, one really would need to have a group and would need to show different. It all depends on how much leadership quality you have shown. Have you promoted several PhDs already? Have you, for example, developed a master program or contributed to education on the basis of what you have found, and so on? I think senior is really a sort of the final end to it, and people can look into the exact definition. I would be, if you haven't had an India Alliance application beforehand, you would need to have good other grants to directly go for this senior stuff. And for the intermediate, you would at least also be sufficiently able to show that you're able to have brought some competitive grant applications. Could also be in the field of innovation, that for somehow you managed to organize some money and you had some innovation and you developed a care program or something else or so on. I think this, but you need to have been able to find some funding.
Okay, thank you so much. We just have one more question for Professor Indra. So if it's a tech innovation in public health delivery in Indian context, based on existing research elsewhere, would it be considered? So tech innovation in public health delivery in Indian context. So
of course, I mean, there's always a part, there's always an implementation question, like, a typical grant application holds 2 to 3 work packages, so to speak. And you do not necessarily have to reinvent the wheel for Indian terms. But of course, what is often, it depends also again on the level of seniority of the trial, but often it is the case, ideally you would have had a trial that has shown that it is, or a pilot that shows that in principle it should be feasible to apply that technical innovation in the Indian context to start with. And why is that the case that you believe you selected? And if it is, of course, a very a costly application, then I guess it's often very critical. Then you would, I guess, have some really an expertise panel to to convince the committee that you can invest in that, you know, to implement. But of course, I mean, this is like why we have the global science exchange. If something has worked out elsewhere, the question, of course, then is what is your specific research question within the context of the CPH fellowship you would want to answer with that. So you are, it's not like, you know, simply implementing it within the Indian setting. That would not be enough.
Okay. I guess with that, we are done with the questions for you both. And thank you so much for being here and, you know, taking out your time to motivate our applicants and encourage them. I hope we have see a lot of applications this round.
Indeed.
And thank you.
Was a pleasure being with you, and I'm looking forward to the applications after the summer.
Thank
Bye
you.
bye.
Thank you so much.
Thank you.
Thank you. Bye bye.
Bye bye.
So we'll, yeah.
I'll go out now.
Yeah, sure. We'll have the next speaker. Yes. So in the next, just a minute. Yeah, so next we have with us Dr. Shushmita Chatterjee, who is a senior health economist at the George Institute for Global Health. And she has done her PhD from the University of Calcutta and is interested in investigating costing of health services, health financing, economic burden, and economic evaluations. She has worked on several health economic projects in the area of mental health, diabetes, cholera, typhoid, immunization, and tuberculosis. She was the recipient of Asia Fellows Award in 2008 and Indo-US Public Health Fellowship in 2013 and India Alliance Intermediate Fellowship in Clinic and Public Health in 2018. So she is our active CPH Intermediate Fellow, and she'll share with us her India Alliance experience. So over to you, Shushmita. You can share your slides or.
Thanks, Devani. Let me see. Yeah.
So after her presentation, we'll take the general questions for her and some general questions regarding the CPH applications. Please.
Can you see my screen?
Yes, we can. You can start.
Okay. Okay, so thanks, Devani. And I'm as introduced, I'm Shushmita Chatterjee. I'm a senior health economist at the George, and I'm a clinical and public health intermediate fellow with the India Alliance. First, I really want to thank India Alliance for giving me the opportunity to talk about my wonderful experience with this fellowship. Before I talk about my experience, let me briefly tell you about my study, and then I'll go to the other points. So my study under this fellowship was the economic burden of tuberculosis in India. I'm sure you have heard about the disease TB, and this is a huge problem in Indian context. India has the highest TB burden in the world. In this study, what we tried to do was, even though the government provides free treatment to and diagnosis, some of the diagnosis to the TB patients in the government setting, the patients still spend out of pocket, and often the out of pocket expenses are so much that it creates a catastrophe for them. So we wanted to estimate the overall economic burden of the TB patients in India, and we interviewed our study population or participants were 1,482 patients with drug susceptible TB, which means it's a simple TB, what we know as like general TB, who can be treated with general anti-TB drugs. And we had 149 patients with multi-drug resistant TB. From the name, you can understand that they are resistant to general TB drugs, and so they require a lot more complex treatment regimen. So we have these participants in our study. These participants were from 4 states: Assam, Maharashtra, Tamil Nadu, and West Bengal. They were from 16 districts of these 4 states. Generally, the patients registered in the government system are registered under the TB unit, what we call. And we got our participants from 118 such TB units. Well, generally, one TB unit covers 2 lakh population. So you can imagine what was the spread of the spread of our work. And some of our participants, a significant number actually, were from the tea garden areas, because the people living in those tea gardens are very high risk of having TB. So we had our participants from there, and we covered 182 such tea gardens in our study. Now, what we did was we actually interviewed these patients. So 1,482 patients, you probably know that these TB patients require, normal TB patients, general TB patients require minimum 6 months of treatment. So we actually followed them, interviewed them twice during this 6-month period, and we went beyond that. We interviewed them 6 months post-treatment. So that means that every patient we interview 3 times, one within this 6 months period, and then one after 6 months of their completion of treatment, 6 to 8 months. And then 149 days drug-resistant TB patients, their treatment regimen is minimum 9 months and maximum 24 months. So we interviewed them minimum 3 times and also 4 times throughout their treatment regimen. We could not follow them up after treatment completion, but we completed we interviewed them throughout their treatment regimen. Now, what are the unique features of our study? First, these 1,482 TB patients are the representative patients of their respective groups. We had few groups. I'm not going to those details now, but our patients are representative. What does this mean? This means that if the government wants to take any policy, then they can easily use our results, because our patients are from wide range and they are the representative patients from different groups. So the policymakers can use, policymaker, researcher, anyone can use our data as like showing that this is the data for Indian TB patients, okay, seeking treatment in the public sector. Then WHO has a definition for catastrophic cost. So it defines what it means when we say that the patient is facing catastrophic cost. So they have a definition. But in our study, the unique thing is that because we have a representative sample of TB patients, we are estimating the catastrophic cost for Indian context. And we are seeing whether the WHO definition of catastrophic cost is really applicable for Indian context, or we have to revise it. Maybe because India is a country with a huge population, with a huge number of TB patients. And as we are doing something very new, so and with a representative population, we really want to see whether this catastrophic definition is applicable for our patient. Then we are also estimating the burden in the post-TB period. That's the first time we are doing in India, where we are trying to understand the burden in the post-treatment period, like what happened to the TB patient in terms of economics after they completed their treatment. And then we are also understanding the economic burden on the multi-drug resistant TB. As I said, they require 24 months to complete their treatment. So we are estimating their burden as well. So these are the unique features of the study. Now coming to the features of the fellowship. As you now see that one of you actually asked this question, what are the thrust areas? Now you can see the areas of research can be anything in clinical and public health. I am a health economist by training. So my research was funded through India Alliance, and that is on health economics. Dr. Srinivasa's project was on eye health. And as mentioned by Dr. Indira, that there can be anything in clinical and public health. And so that's first thing, that area can be anything on relevance, which will prove that it is required to do in Indian context. Second thing is the duration. That's a very unique thing of this fellowship, because if it was not 5 years, I was not able to, I mean, no one can do this kind of follow-up of this many patients. So 1482, that's how I have the representative sample with me, because I have the opportunity to follow each patient 3 times, even after I can follow them post-treatment. Only this 5 years duration had given me this opportunity. And also the complete follow-up of the MDR patients, because they also needed like 24 months of their treatment. Then coming to the point of budget, it's sufficient budget. It is very flexible. There are some fixed elements and there are some flexible elements, and I would say it's enough. And it covers almost everything that is required to conduct a study. I'm giving my example. That's why I gave the example to show you how it covers everything. It covers staff, it covers travel, any other expenses. You can imagine I had to travel to all these 4 states, to 16 districts, to 118 TUs, and 182 tea gardens. Those who had been to tea gardens, you know how interior this could be, and travel expenses can be very high. So everything can be covered through your project, through this fellowship. And then meeting and printing, photocopy, everything can be covered through this fellowship grant. And then we also had, like, we interviewed the TB patients so many times. You know, the TB patients are very sick at the beginning of their treatment, and they gave us time for interview. Our interview took at least 1 hour per interview. So we actually give them some nutritional support for their time as a token of appreciation, and that was also budgeted. Then, as Dr. Srinivas mentioned, open access publication, which make your publication openly available to all researchers, everyone. So that's another important component. And as mentioned, that it was said that you can hire this many staff in your proposal for particular type of fellowship. But if you can justify, I will come to that. I have the wonderful team of 13 members for my project, because I needed these people, because there are so many interviews, and I needed the local language speaking people, because the TB patients speak in their own language, state language. So I needed those, my researchers team. So this team is for all 4 states, and I had 13 members in my team. Now coming to the useful pointers from the selection process, I felt that it has to be a very clear and specific about the proposal. When you are writing the proposal in the preliminary stage and the next stage, the full application stage, it has to be a very clear. You have to see the project from the beginning at the end very clearly. What you want to do, how you want to do, and even you have to see the problems, the challenges that may come in your proposal, and how in the project while implementing, and how you are going to overcome those. I clearly remember that I was asked these questions. I had estimated few numbers of interviews per day, and accordingly frame my time for the for whole duration of the project and the interviews. And I was asked, if I don't get this many number of patients, what I am going to do. So that's why I'm saying that you have to be very clear, very focused on what you are writing and how you are going to do. And then I told you that I hired 13 team members. I had so much trouble, but everything requires a proper scientific justification. Why you need them? Why do you think you need 13 people? Why do you think you need to travel to those places? Why do you need this? So a very clear scientific justification is required for the selection process. Then another thing is, what is new? I told you that there are a couple of unique features, but you know, most of the methodology I was using was developed by WHO and used by other countries, and I was using this. And I was questioned in the interview, like, what is new in your method? You are using mostly the WHO method, which other researchers also used. What is new in your research? So my only new thing here, methodologically new thing here, is to understand the catastrophe for the Indian context, to see whether this catastrophic definition of WHO is working for us. So that's the new thing. Then you have to justify why you. Why now, why you, why other researchers can't do this, why you are the suited person to do this. And so you have to be, and what are the larger implications? Of course, what are the implications? You are going to do a study for 5 years, how this is going to help in future, how this is not only to you, to the community, to the policy, what is the use of your results? And then, of course, the experience of working with a committee. So from the very beginning of your application, you will be attached to a grants advisor who will be helping you throughout your process. So from the very beginning, I remember that when I was starting to apply for the preliminary one, there was some technical glitch which Devyani was mentioning. So try to do it before. So I was facing that, and I got panicked, and I wrote to my grants advisor. She said, "Don't panic. We'll figure this out, and you can submit it on time." So every time you will get the responses from them. They are very prompt. They will help you. If you have any question, any clarification required, ask them. So from the very beginning, preliminary, full application, during interview, during post interview, and throughout the fellowship period, they are with you, the grants advisors. Then the committee, you have already heard about from one of the committee members. They will provide they will review your application. They will be there in the interview process. And while reviewing, the external reviewer and the committee members, you will get excellent comments from them. And that will help you think through how you want to improve, how you are going to face the interview. And it's not only about your technical thing. One of the reviewers actually was concerned about my safety, because I, as a researcher, I will go to the field, and he or she was worried about like how I'm going to be safe in the field. So you will get all sorts of very constructive, very helpful information from the committee. And then progress report review. Every time you need every year to submit the progress review, and then also you will get in the mid review, you will get very good feedback from them to figure out where you are and what you need to do more. Or more constructively. And interview process also, I said, they are very helpful, though it is a little tense situation because there will be so many experts with you, but they really wanted an answer from you and want the clarity, wanted to check if you have that clarity. And finally, the finance team, who will be also with you throughout, like for budget, for any clarification regarding budget, from starting from the application and then throughout the process, they will be with you. So that's my wonderful experience working with the India Alliance team. And these are some of the glimpses of our work, like going to the patient's house and interviewing them. So thank you for giving me the opportunity to talk today, and thank you for listening.
Thank you so much, Dr. Sushmita. Thank you for the thorough explanation about about the selection process, the useful pointers. I'm pretty sure our applicants would have, it would be immensely helpful for the applicants. All your selection, the pointers you mentioned were really appropriate and so useful. I suppose it will be very useful for them. And as for questions, I see there's one question for you. So yeah, we'll proceed to the question answer round, and just a minute. Yeah. So how to choose collaborators for a research project? How to strengthen a research proposal through collaborations? So you can go in.
Yes, so that's another very important point, the collaboration, because let me give you my example first. Like how to choose is, you have to think about like how you can get help. What kind of help do you need or collaboration do you need? Because as Dr. Srinivas also said that everyone will not, this is a fellowship, everyone will not know everything, right? You need a collaboration to find a help. Like, so, you know, for my case, the government, all the state TB units and the central TB unit of the ministry are my collaborators. They are my collaborators because they are going to use my study. So from the very beginning, I involved with them. I told them that this is the plan because it has a policy implication. I'm not going to those details, but it has a policy implication. So from the very beginning, I started talking with them, speaking with them, say that this is what, do you think this is of relevance? They said, yes, this is of relevance. And they gave me the collaboration letter. And then every state, I told them that this is how we are going to do. And all the state TB officers were our collaborators. And so this is you have to figure out that who in your study can help you to do it in a better way. Some organization or one person who has probably done this kind of work, the work you want to do, if he or she comes in terms of methodology, in terms of application, anything. So if he or she comes as a collaborator, then your proposal will be strengthened and you will learn from the person and you can develop together, right? So that's how you can choose your collaborator.
Thank you so much, Sushmita. So now I would request the participants to raise their hands virtually. If you have your questions, you can directly ask us. We'll unmute you, and you can then ask directly our speaker. In the meantime, I'll see if there are questions in the question box. And Himashri, if you see any hands, please unmute them.
Sure, I'll do that. I can see Rajiv with the question, so I am unmuting.
Yeah.
Please go ahead and ask your question.
Hi, thank you for the wonderful presentation. I just had this one question, general one. In the beginning, you mentioned a letter should not be provided by the fellowship supervisor. So can you just elaborate? So whom should we get a sponsor letter from? That was my question.
That statement was that you need a letter from fellowship supervisor and a letter of recommendation separately. These are two separate letters. So for an early career fellowship, the letter of recommendation is not provided by the fellowship supervisor. Fellowship supervisor is a different role, and a supervisor who is providing you the letter of recommendation is a different role on the application. Does this help?
Got it. So I can get the recommendation letter from my say mentor or any other person whom I work with.
Okay. So letter of recommendation is received by your past supervisors through your career, like your PhD supervisor or your postdoc supervisor. They provide you letters of recommendation. Letter of support is provided by the fellowship supervisor, who details on how he or she will be able to support you in the current proposed project.
Got it. Thank you so much.
Thank you.
Thank you. We have one question for Isha. I can take. So, can more than 2 support staffs be allowed for intermediate fellowships?
Allowed are 2 support staff, but as Sushmita also explained here through her presentation, if you need more than 2 support staffs, we are flexible for CPH projects, and we would require a proper justification and a letter of support from fellowship supervisor also corroborating the request, and the same then will be considered by the committee. So you can put forward the request with proper justification, but the request will be reviewed by the committee and it's upon them if they will accept it.
Okay, thank you, Isha. Are there any more hands, Himashri? I don't see any.
Nobody else.
Okay. So yeah, maybe we don't have many questions. Just a minute. What quality?
I see a question in the question box. Can I get a LOR from a potential mentor or collaborator? Yes, you can do that. You can get a LOR from your potential mentor or collaborator. That is fine.
Yeah. There are some questions from the registration during registration, those asked during registration. So they have asked about if like we are from this background, food and nutrition background, and some other background also I've seen, and will you be eligible for the scheme? So I would like to just add here that if you have the degrees that we recognize, you are eligible. Like you should have for the CPH fellowships, you should have as MPH or MD or PhD. So if you have these degrees, you're eligible to apply. The background doesn't matter, but as long as your proposal falls within the remit of our CPH scheme. And yeah, so we have already crossed our time. I think we can end here. Mashri, then just
So if there are no more questions, I'll go ahead and towards the end announcements. So thank you to all the speakers for wonderfully explaining the fellowship today. Before we end, please allow me to make a few announcements. I would like to remind you again that the call for applications for the CPH fellowships are open now, and that the application deadline is 10th April 2023. And as we have learned that we should not wait till the last date, so please begin filling your applications. And if you face any issues while filling the applications, please write to us. You can write to us at grants@indiaalliance.org or info@indiaalliance.org. We hope this webinar has helped you to understand the application process better. So if any of your friends or colleagues missed out on today's session, then you can always follow the webinar through the recording, which will be up on India Alliance channel within the next few days. Keep following us on our social media, Twitter, Facebook, and LinkedIn to keep yourself updated about our other grants, fellowships, workshops, and announcements. So this brings us to the end, and I would like to once again thank all the speakers, both the external speakers and the grant advisors, for their clear presentations, for clarifying the participants' doubts and answering questions, and also the team at the back end. So thank you once again for joining us today. Please take care and stay safe.
Thank you so much, Himashri. Thank you, everyone. Thank you, Sushmita.